Kaylee. I wanted to have no care. I wanted to have her compassion. It didn't matter that other kids ran away from her when we were out. I'll still take you out. Where do you want to go? She loves French fries and chicken nuggets, loves McDonald's. Let's go. Let's go sit in public and have dinner. You want to take your iPad? You want to make some noise? Yeah, she's very noisy. She likes singing. And that's amazing. What mattered to me, like I have said throughout this whole entire presentation, was her happiness. What mattered to me was that she was supported in everything that she did by everyone she met, because everyone she meets and comes across, her personality resonates with all of you. And that was the biggest thing that I needed from her. And that's how I overcame that stigma of there's something wrong with my child, or your child's different, or your child doesn't look like my child, or your child doesn't act like my child. That don't matter. She's my child. She's happy. I provide what she needs. I went out and got the resources. I communicate with her case manager from Blue Cross Blue Shield to ensure that she has every type of activity that she can have. She did horseback riding lessons. She loved it. Haley's in there petting a little pony named Marshmallow. I don't want to pet Marshmallow, but you have a wonderful time. You know, she enjoyed that. And it was just nice to have resources that were able to provide her with life, to able to provide her with the norm that I needed, that she was not getting. So I'm a qualified mental health professional, quote unquote, right? My journey started when I completed my associate's degree in chemical dependency counseling. I thought I wanted to be a addictions counselor. I tried it. It was fine. Then what's next? I got my social work degree, my bachelor's in social work, and I started working in the school system, and also had a child at the same time. So it's kind of like, I'm a parent now, but I'm also an advocate for kids that are going through situations in the school that no one knows about, that they're afraid to speak about. Kids that came to school not dressed properly, didn't get their hair done, didn't have nothing to eat, didn't have lunch money to get anything to eat. You know, coming to school with no homework done because their parents didn't have the time to help them do their homework. So working in the school, it kind of just made me feel like this is where I belong. I wanted to help kids. I wanted to help those who were unable to speak, didn't have a voice. I wanted to be their advocate because I was becoming an advocate for my child at the same time. As my journey with Kaylee kind of began, I just started feeling defeated as a parent, but then it all changed and things brightened up for me. I felt as though that stigma that we were a part of because she wasn't developed with other children went out the window. Working with those other kids really brought a lot of stuff home for me. It was then that I realized that Kaylee was my biggest blessing, to be the blessing I am to those who I work with, providing my human service work. And that's why I am strongly in this field to help others, because I was at a time where I needed help. And I remember getting turned away from community health workers or social service workers because, oh, well, you just make too much, so good luck with everything. It's like, okay, but this is a little bit different. You know, I'm not asking for money for food or, you know, rental assistance. I need support services for my child. But I was turned away because I had a salary that I had to make in order to be a parent, to provide for my child and myself. So I got in this field and I became this qualified mental health professional because I wanted to be that person sitting on the other side saying, we're going to find out how to get this to work for you. We're going to figure it out. It might not be today that I give you an answer that you're looking for, but I'm going to come back and give you something that you can take with you to kind of get you where you need to be. And that's what I did. I worked in shelters with women who had children who were living domestic violence situations, to help them get the resources that they need for their kids. You know, I was there providing tutoring sessions with their children in the shelter after they got out of school to help them get their homework done, because I knew how important that was. I did after school programs for kids who couldn't go home after school, specifically girls who didn't have those parents or those role models and a mother that they needed for hair situations or puberty, things that they were going through. And this is at the elementary school stage. So I feel as though this journey that I've been on has been one that was hitting home and it was really personal. But now I know that I'm making a difference in some type of way, which is the main thing I've said my entire life. If I can make a difference in one small step, no matter what I do, even just having a conversation on the phone to stop you from going through your crisis or to help you with a resource that you need, I feel like I accomplished my goal. And that's what my goal has been in my journey. So I also had experience at Dell Children's Medical Center. And this is where we're going to get into talking about mental health issues in our teens and adolescents that we're dealing with and how to kind of face those, because a lot of parents are afraid to have these conversations, and a lot of parents are lost about what's going on with their kids who live right in the house with them. At Dell Children's, I worked on the mental health unit where we assisted teens and children from 6 to 18 who were dealing with any type of crisis, dealing with mental health issues. A lot of them had been through trauma that they weren't able to express to their parents, which involved them doing self-injurious behavior, having suicidal thoughts, homicidal thoughts, or really just acting out, as parents would say, but having behavioral issues that were more deeper than them acting out. I worked like one-on-one with these teens and kids and really got to have that conversation that they wanted to have with their parents and got to understand what it was that these teens and what these kids were really looking for their parents to understand. And while it was very challenging, I will say it was a very challenging career, because I don't ever want to hear a teen or a child say they want to kill themselves because they just feel like they're a burden to their parents, or they feel like they don't have support that they need, or they can't talk about what they're going through. It hit different being on the opposite end, but as a parent and also a human services professional, I'm like, that could be me one day. I could be that parent that may miss something that was said, or overlook a child who is not doing good in school, their grades are failing, they don't want to get up out of bed. You know, certain situations, certain circumstances that were going through a teen or a child's mind, they brought it to my attention. And in our circles and our group sessions, that was the main thing that they wanted, was to be able to talk about it to their parents without feeling like their parents would be upset, or that their parents would judge them, or they wouldn't get the support that they needed. Mental health in our children is really important. It's not simply just the absence of a mental health disorder. Children who don't have a mental health disorder might differ in how they're doing, and they have the same diagnosed mental disorder that might differ in their strengths and weaknesses. Mental health disorders among children are described as a serious change in the way a child typically learns, behaves, or handles their emotions. And many of us can see that, you know, with our kids or kids that we work with or kids that we have seen in the news or any situation that you might hear, stories that we might hear. Mental health is a continuum, and the identification of specific mental health disorders is both important to understand, and it tells us how well children are doing. There are many children who would express fears and worries or have disruptive behaviors, and it's because they don't know how to explain what's going on with them internally. And I think we've all been there before, where we can't really explain what we're feeling at a moment. We can be stressed about work. We can be stressed about money, because we have to have money. We have to work. But the times that we have been in and what we have been dealing with things that we see in the news, the pandemics, it's really been hard on all of us. And it's hard for a lot of us to talk about it. But can you imagine what it's like for your kids to want to talk about it too, when you're going through what you're going through and they can't really express what they're going through? It's an essential part of children's overall health. Has a complex interactive relationship with their physical health and their ability to succeed in school, at work, and in society. It can be physical, it can be mental, and it affects how they feel, how they communicate, how they act outside and inside. And it's really important throughout childhood. So early detection and early assessments are very, very important. And I know, because I started really early when I felt like there was something going on with my child. So as a parent, if you're feeling like there's something going on with your child, or if you know a child that may need some early assessment, plant the seed for the parent. And as a parent, that's the biggest thing that I looked for. And that's what has helped me, when someone was able to sit down and talk to me and say, listen, I know this might be hard to hear, but let's talk about what is presented in front of us. But be empathetic and tell them that you care at the same time. Because a lot of times parents feel like they've been to so many people as I did, and got the runaround and got the same thing said each and every time. It's a little bit different when you can sit down and have a conversation that really helps a parent understand that you're planting the seed for them to go ahead and get that early assessment, plant the seed for them to be able to have that conversation with the parents. And when most children at Dell Children's are about to exit their inpatient respite stay, there is a conversation that's had with the parents and the kids to kind of build a rapport and say, this is what's going to happen when we go back home. If I'm having a situation, I want to talk about it openly without feeling like, you're going to judge me, or I'm going to get in trouble, or I'm going to be, put on punishment or something, some type of, situation where they're not going to want to express what they're feeling. Some of the most common childhood mental health disorders: ADHD, anxiety, depression, autism, learning and developmental disabilities, and substance use and self-harm. I was really shocked when I first started working at Dell Children's about how many kids came in from using substances and overdosing on substances and thinking that, this is the way out, right? Or they have tried a substance and had an adverse reaction where they're now in a panic or a state of paranoia. They're secluded in the hospital because they are in a manic state that they did not know that was going to happen when they tried that substance. These synthetic substances that are out now, and a lot of kids get a hold of and think, oh, okay, I'm gonna, use this real quick and feel better, and then end up becoming a different person, going through a situation that they don't know is going on until they come out of it. And like, I'm sorry, you're combative and it was really hard. And I've seen it firsthand. And a lot of parents are afraid and they give up and they just let their kid be in the hospital and don't care, and for kids to not see their parents when they're going through a situation like that is very, very detrimental to all of them. So being that person that was in that position to be able to help those kids, it really opened my eyes to a lot more too. Some facts about mental health disorders in kids: ADHD, anxiety problems, behavior problems, and depression are really the most diagnosed mental health disorders in children. And it starts from age 3 to 17. I mean, depression, I never really thought that depression would be in children that were younger than young adults, but it can start really early. And I've seen 6-year-olds, 7-year-olds that I've worked with, and I have an 8-year-old daughter. So you can imagine how it felt for me when I'm working with these kids in this hospital. Like, I'm a parent, but at the same time, I have to be a mental health professional to a 6-year-old who wants to kill everybody. I have a 6-year-old who was, treated in a very inhumane manner, caged in a dog cage and treated like, just treated horribly. And in turn was depressed, had a lot of situations that started unfolding, and you're only 6 years old, anxiety. We all have anxiety right now, but for a child, you're not living your childhood because you're worrying about big people things, but it's so real that our kids are really facing these things head on. And it really has to start with us being those people that can see what changes have happened with your child. Your child's not acting like your child did a few months ago or a year ago, and step in, do some intervention. Some of these conditions really occur together too. So you can have a child who's got ADHD, but also has depression and anxiety at the same time. A lot of times I've seen children who have behavior problems that root from them having an underlying condition that they didn't know about. Autism is a big one. People feel like their child is acting out, but in all actuality, there's something in their wiring that is incorrect and they need intervention for that. And that was what happened with my daughter. I didn't know she was autistic. I thought she just didn't want to talk. I thought she was just delayed and everything. But as we went on and we started looking at these cues and, had that intervention, had those conversations, the hard conversations, that's when I was like, okay, well, let's redirect how I'm thinking right now, because obviously she needs help. She needs assistance. And that's how all these kids are. Depression and anxiety have increased over time. ever having been diagnosed with either anxiety or depression among children 6 to 17 has increased from 5.4% to 8% since 2007, and now we're at 8.4%. These are just some statistics on what's going on with our kids who are diagnosed with these mental health conditions, who are going through these situations. For adolescents, depression, substance use, and suicide are really, really important concerns. And among those adolescents between 12 and 17, they're reporting that they're at least having suicidal thoughts or homicidal thoughts more frequently. That's why we see so many things in the news, and it's hurtful, but it all can be prevented sometimes too, if we just take those early intervention methods. That brings me to what we can do as a parent or as a mental health professional or anyone who is working in this population with these kids or with anyone. Parents know your child more than anyone else. You know your child. You know when something's off, when something's different, when they're going through something. A lot of times teens don't want to talk to parents. We get that. But why don't you want to talk to me? What's going on at school? Are you being bullied? Because a lot of times their kids are being bullied. There are kids who aren't really interacting correctly with their teachers, with their staff. They're not feeling supported. Figure out what changes you see in your child. My biggest thing is seek resources and do your own research, because it took me doing my own research to find a different location for my child, a different location for my family to grow, and a different location for me to be able to say, this is where we need to be. This is going to help us for right now. And I'm saying Texas is going to be forever, but it's right now it has worked for the last 3 years, almost 3 years for my child. She is thriving. And it took me seeking out more resources, additional resources, and doing my own research and asking questions. Ask your healthcare provider. A lot of times they won't come out and say what you want to hear. You have to really push for that. And if you don't like the answer, go to a second opinion. I've had 3, 4, 5 doctors that I've met with in the course of 8 years for Kaylee. And it took the last one, then I got here, to actually sit down with me, give me that redirection and say, listen, I know you've been here. I know you've been here. I know you heard this. I know you've gone through this, but this is where we're at. And we can do this. We can do all of these things, but you tell me what you're comfortable with. And he met me where I was. And that was what really resonated for me too, when it comes to healthcare providers, asking those questions and getting them to meet you where you are. Pay attention to the changes and behaviors, their moods, their grades. Ask them how they're feeling. That's a big thing. Because 9 times out of 10, when I see a child or hear a child talking about suicide or talking about being depressed or anxious or whatever situation they're going through, it's because they have not been asked how they feel. And that's me speaking on behalf of every child that I've come in contact with, whether it be from the children's hospital or a crisis hotline. That's the first thing they say. No one asked me how I feel. No one asked me what's going on with me. No one asks those questions. And it's hard for parents sometimes. I get that. It's hard to ask those questions, hard to have those conversations, but they're important. But the main thing is these kids are ready to talk. A lot of them are. And they just are waiting for you to say, how do I feel? How do you feel today? And then aim for early diagnosis and treatment. I had a conversation before I was actually asked to present this presentation. And the conversation was about my journey with Kaylee, and this is how I got to be a presenter today. And how do you get parents to want to do early assessments and diagnosis, especially when they know that their child is not developing the way they should, or there is something underlying going on? And what I said was, we're never ready to have those conversations or to hear those words that your child has whatever it is, right? We're never ready for that phone call from the doctor that says, well, this is what we discovered and this is what we can do. But putting my parent hat on, when you can plant the seed for me and say, I know this is not what you want to hear, but this is what's going to help. I know it's what you want for your child. I know it's what you want for yourself. It makes a whole big difference. And I really will say, anyone who's in this room today, whether you're a parent, whether you're here because you're going to be in this field working with whatever population you're going to work with, your conversations matter to everybody. how you present yourself and how you direct what you're going to say matters. And of course, anyone who's in a field to provide human service work, be compassionate about what you do. That is one of the biggest things that I can say that felt good for me as a parent, but also I take with me as a mental health professional. And that's what I have. That good? Yeah, 10:30, great. Okay.
And we're going to open it up for questions. If anybody has any questions, let me know. Those that are virtual, we'll get those questions as well. I'm going to ask that you guys use the mic to ask your questions so that the people that are virtual can hear the question. I saw a hand over here, or no, back here. Here.
So first, just thank you so much for being the person that you are. I wrote down some notes from what you said just because I wanted to make sure to say them out loud and remember. So as an ex-inclusion pre-kindergarten teacher, I have seen parents, I mean, like the richest schools, completely deny what they are seeing and completely deny and ignore teachers and professionals and such. I've seen teachers do horrible things as well. And I've seen, thankfully, more that are there for your child. Mm-hmm. And so thank you for doing this. Thank you for your presentation. And the only thing that I guess I want to point out is that medical model mindset of, and this is not putting this on you, it's just that the medical model mindset of mental illness and incorrect neurology, there is nothing incorrect about your daughter. There exactly. is absolutely nothing. And so that's why, again, I'm thankful because you recognize that and are here talking about it. Mm-hmm.
It took me a while to get there because I was stuck in that, I wanted to not do the resources. I wanted to not do the interventions. I didn't want her to go to therapy. Those are the things that I kind of felt like it's going to make me look like I'm walking in here with a child that has to have therapy. And I can admit this now because she's older and I've overcome that. But I was really afraid. And because I was afraid, I didn't want to get her that help. I didn't want to look like that parent that was taking a child to Easter Seals or look at that parent has a special education child with IEP. Like I felt like that was the biggest stigma for me. And like you said, those parents who just deny, I denied for a long time. My best friend, who I have been best friends with for 22 plus years, we have a daughter that we share because she was born 6 months after Kaylee. And they would play together. And I was like, no, she's gonna reach Devin. She's gonna get there. She's gonna get there. And when she wasn't getting there and Devin was doing so much more, I'm like, y'all are 6 months apart. What am I missing? And it took the Birth to 5 program coming in my home and sitting with me and Kaylee and Devin and Tamika, and we all sat together and we had a conversation and like, Key, this is what's needed. And that was it for me. That was what it did for me. And I can't tell myself enough how proud I am for, overcoming those medical things that just aren't right. And I want to hear that. I overcame all that. I know my child's very special, beautifully special. She just needs a little bit of intervention, little assistance, right? And that's all she needs. She's good. She's amazing. And I will continue saying she's amazing. But it did take me a long time to get to where I am today, to that point of not worrying about any of that and getting her everything that she needs. So I thank you for mentioning that and pointing that out.
Okay. As a parent of this wonderful young man who has had his problems, something that wasn't physical, but mental, admitting that there is a problem, noticing something that's not right and saying, I've got to do something for my baby. There's something that's not right. And it's an instinctive sort of thing. And we have got to stand up for our children.
Yes.
Not what's going on, not what everybody says. Stand up for your child.
Yes.
Support them, be there for them.
Be their biggest fan, their biggest advocate.
Their biggest fan. And that's why I'm here now, standing up for my baby. All right. Thank you.
That's wonderful. Yes.
Thank you both. We do have a couple questions online.
Okay.
The first question is, are there support groups for parents?
Yes, absolutely. What I have found that a lot of my support resources came from Kaylee's school. They would send me emails about different events that they would have for the parents to come together. They would send me a list of resources for community supports that I could go out. That's how I got in contact with Kaylee's case manager through Blue Cross Blue Shield of Texas, which provided her with the course therapy. And they can really provide any type of thing, anything that I want Kaylee to do. There's a list and I can call and say, I want Kaylee to do this. And she's like, okay, I'll set it up and they'll do it. But it's really just the resources came from the school, but you can also do research on like Texas Health and Human Services website, which has a whole list of things. Class is something I added her to, which is a very long list. I mean, a very long time frame, but the earlier you get her on, when she becomes an adult, you know, she's set. So it really just had those conversations with the teachers, ask for additional supports, guidance counselor, whoever, or email me sometimes. You know, if I could provide my information, I would be happy to send any resources that I have that may help anyone who's listening today or here today. So.
And just to add to those resources, you also have your local intellectual and developmental disabilities agency through Integral Care. VELA is another, Autism Society of Texas. There's just a lot of different resources out there in the community for parents to access. Another question is, how can I be a better listener to my grandson?
What, just, is he going through anything or it's just?
There's not clarification on it. It came from the virtual.
Like I said in my last slide, sit down and ask how you're doing. Because when you ask that question, it opens up a whirlwind of emotions and feelings and things that they had not mentioned before. So if your grandson is going through anything or if he is facing anything, the biggest thing that you can do is sit down and ask him what's going on or ask him how he feels, because that makes them feel like they're open to be able to speak about what's going on. I know a lot of kids that I've worked with at the mental health hospital have really just said that they want to have that conversation of what is going on with them by having their support person or their parent or whoever they're with, just say, you know, are you okay? How are you feeling? That's the number one thing I can say to help you start listening to what your grandson's going through, and pay attention to the cues of the differences and changes he have in his moods and in school and his grades, whatever the situation may be.
Thank you. Are there any more questions in the room?
I guess mine's not more so of a question, but I just wanted to say I commend you with your strength and everything, because I also have a 9-year-old daughter that wears hearing aids and she wears glasses. So I know sometimes she gets like overwhelmed and stuff, having to go to school, put her glasses on. Like every morning, I'm just like, Naraya, did you put your hearing aids on? Do you have your glasses on and your mask on? So every morning she's just like, Mommy, like I have my hearing aids on. I have my, or it's like she'll complain sometimes because she has to put her mask on over her hearing aids, over her glasses, and it gets kind of overwhelming at times. So it is good to always check in with your child because you just never know what they're going through. So her having like wear all of those things on top of, like you said, going to see the ophthalmologist and things like that, and all these specialty appointments and things like that, it's always good to just sit down and check in with your child, because you just never know what they're going through. And I do make sure to do that with her, because there are mean kids at school. There are mean kids, a lot of bullies. So yes, definitely make sure to check in with your child. So I agree.
Like,
Yes.
Being able to recognize that it is important to check in,
Yes.
but also recognize that there are mean children who parents have not corrected them, and you can't really hold it against the child.
Yeah.
Don't hold it against the child, but the parents have to be accountable also. And,
Oh,
you know, like I said, I have experiences with parents where I'm just like, look, teach your children how to be better for those who are not like them.
Yeah.
Because they're just as much a part of this world and just as much able to be around and interact and have a life that's norm. They don't have to be treated differently. So I commend you for that too.
There was somebody else up at the front, and I know there was a question in the back.
Good morning.
Good
I
morning.
too commend you and to the grandmother online. Just pick up the phone sometimes and just call and say, hey, what you doing?
Mhm.
That's all you got to do, because I'm a grandmother.
Yeah.
But I also commend you because I have a daughter that my grandson is now 10.
Mm.
And at a few months old, he was jabbering. Like we're having a conversation now, but it came out like blah, 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 blah,
Mhm.
blah, blah, blah. So she easily recognized something was not quite right because it was not coming from the brain to the mouth.
Mhm.
And he was already she lives in Georgia,
Mhm.
Cobb County, Georgia, outside of Atlanta. And she immediately said something's wrong, speech therapy. And they realized he was not having hearing problems or anything. So from the time he was little, he got in speech therapy and they did that. Then he was at daycare and pre-K and everything. And so she recognized immediately
That's great.
because he was angry.
Mhm.
He was always
Frustration. It's a lot of
angry.
frustration. Mhm.
And that helped him a lot. He's just turned 10 last month.
Mhm.
He speaks in a very sing-song voice.
Yeah, that's my daughter.
But this little boy, he's now preteen, which he will tell you he's preteen until he has to, do a chore. Now I'm just a kid. But the other day, she let him ride the bus home on Fridays now. She gave him a cell phone last month. And I thought you'd like to know this. She gave him a cell phone for his birthday last month. Friday, I get a phone call from Georgia. Grandma, they wouldn't let me off the bus. And I said, okay, where's your mom? She didn't answer the phone. Where's your dad? They both work from home. He didn't answer either. I said, okay, what are you going to do? Well, I'm just going to ride the bus until she lets me off. Usually this boy would have had a total meltdown, but he's progressed so far because like you, he's in an inclusion, your kid, he's in an inclusion class, but they keep him in the inclusion class. And last year they started pulling him out for like reading because he's been reading since he was like 4. He's highly intelligent, but he has these issues. He still has meltdowns. But I mean, I just want to tell you to keep pressing.
Thank you.
Keep pressing. He'll get there. This boy
Thank
did
you.
not have a meltdown. And I was so proud of him. So, but just keep pressing.
Thank you so much. Yes, I have grandmothers too. One's here and one's in Maryland. If I don't go and text her or call her in the like 4 or 5 days, she's calling me. Is everything okay? I just want to make sure everything's okay. Yeah, Nana, I'm in a meeting. Oh, I just want to make sure everything's fine. I haven't heard from you in 3-4 days. So, okay, Nana. Yeah. 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 That's good. That's amazing. But kudos to your daughter for the early intervention that she took and your grandson who is just thriving in life. It's amazing.
So we have another question from online,
Okay.
and I know we have one more question in the back. The online question is, how can folks support parents helping their youth through this process? And I'm
So those
assuming
are-
the process of maybe early identification or being or getting that assessment to identify what's going on.
Plant the seed for the parent. Really just be that parent's support because the parent needs to support too, not just the child. A parent needs to be supported when they're going through situations that they can't really understand about their kid. And I feel like us as professionals working with these parents, it really just means that you have to be supportive to them. You have to be willing to sit beside them and say, we're going to get through this together because that's what they need. They can't have someone that's going to come in and help and then disappear after it's all said and done. Because a lot of parents need support through the whole entire thing, no matter what their situation may be at home. So I really just would say, just plant that seed for the parent and say, I'm going to ride this out with you. Because that's what we want to hear. We want to hear that someone's going to be with us. Like my support system is amazing. It consists of my mom, my dad, my grandparents, everyone is here and there, but it took also professional support too, where they check in with me every week or every couple of weeks or every month now. And she's like, hey, I'm just checking in, see how things are going with Kaylee. Do you need anything? What can I do for you? That type of thing it's impactful and it means a lot. So I would just say plant that seed and be there for that parent as their support.
Okay. I guess my question was, how would parents go about finding the right provider? Because there are providers who are quick to say, well, this child is just being a child, or they're not, they're having they don't want to show the signs and symptoms. So and then the parents spend a certain amount of time trying to go to different doctors and get consultations just to see, because they know their children, but they can't find, especially children that are minorities, they're quick to just ignore the signs and symptoms. So how would a parent go about finding a provider that will listen and will, put in the effort?
I did my own research a lot when it came to me finding a provider for my child, which I felt like I was my biggest advocate in that sense because I knew what I wanted. I knew what I was looking for. And like I read reviews most times, and I ask questions to people who I wanted support from, like in the school. Which doctor do these children go and see? You know, which services do these children receive and from whom, and how did they get there? It took me asking questions outside of what I knew after I did my own research to really dig down and find out exactly where certain kids were going and who they were meeting. So I would just say, like, literally do your research your own self. Find the doctors that are in your network. I know a lot of times we don't want to go out of network because that costs a lot more out of our pocket. But if it has to come down to you having conversations with even parents that are in the same classroom as your kid, and your kid, they may have the same situations going on, ask them, who's your provider? Who are you going to see? But that's the biggest thing. That was what I did. I'm a minority too. So I was doing my whole research from the time I was in Maryland driving on down. I think she had a question.
She had one more question. I'm gonna come up there to you too.
My question is not just finding for a provider. You came from Maryland into Texas.
Mhm.
There's a lot of states that doesn't provide the kind of services that you're saying Texas does and did and is doing for your child. Is there a list where parents will know, because as your child advocate, you will go to where the services
Mhm.
are? So are there states or places that, or a list where we know services are provided for children, that they care about children?
I went on Texas Health and Human Services. I think it's how it's said. I think it's the website, but it has a listing for adults and for children who are dealing with disabilities, who also have any type of mental health crisis. That's how I did it. Because when I came from Maryland, I looked at North Carolina. I was looking at different states that I could possibly go to get the services I was looking for, that school that I wanted. I had an interview in North Carolina, but then I came across Texas because one, I had family here, and I also have an uncle who has IDD and is just like my daughter. And you know, the relationship is really amazing, and it's kind of neat to see them interact. He's 52 and she's 8, so it's amazing to see their interaction. But when I came here, that when I did my research before I left, I found the school. I found that I could qualify for certain programs that were on the website just based off of what she was going through. And I started applying before I even got here. So I sent my information out to these sources before I even had an address of where I was living in Texas. So I would just say the websites, that's where I found my list, but also what Ms. Sonia said about integral care and all the other resources that are available for parents. I don't know if we can provide a list later.
And off the top of my head, because that's part of the job that I do, I probably could provide a list, but the other thing I would add in there is educate yourselves. There are parent support specialists in every school within Travis County that I know of. There are also QMHPs, which are your qualified mental health specialists, integral care on the child and family side, as well as the intellectual and developmental disability side. Value added services that you're talking about with your Blue Cross Blue Shield, that's part of the Medicaid, and getting that case manager to help you navigate about advocating for your child. That is your biggest weapon in that advocacy, is educating yourself. Do not wait for somebody to educate you. Pull down idea off of the Texas Education Agency's website. Read it, know what the school can and can't do when it comes to special education. When you're trying to get that individual education plan, when you're trying to get an outside assessment because they won't accept the assessment, you don't agree with the assessment they did. There are parent support specialists out there. There are parents supporting other parents. That parent peer support, you have to lean upon your community and collaborating with people. And that's a purpose of this conference also, is so that you can collaborate amongst people and get new resources and networking to find out what's out there in the community. Because believe it or not, Texas is like 48th, 49th in the state. I mean, in the country when it comes to mental health, but we still have a lot of resources here compared to other states. And so it's that's a blessing.
Yes,
But it's really word of mouth, like you said, asking those other parents. Don't be shy.
Yeah, you can't.
Don't be afraid to
Closed
ask.
mouths don't get fed. That's what I'm saying, right? Closed mouths don't get fed.
And don't be afraid to say no. I don't agree.
Yeah,
I tell parents all the time, do
Uh-huh.
not do that bobblehead effect like this.
Yep. Just because you
doesn't
said it
help
don't
you.
mean I gotta agree with that. You
Yes.
said that, but I don't feel that. I don't feel that in my spirit. That's not telling me what's going on. So we're gonna thank you for your time. We're gonna go somewhere else. That's what I did. thank you for your time, but I'm gonna go get another opinion.
So my question is, how, as an advocate, I'm a certified family partner. This is my manager, systems of care person. So we do a lot of the wraparound supports and services. And what I've noticed, and I'm so glad to hear you say that Texas was the place you came for services, but it might be because it was on the IDD side.
Mhm.
And so a lot of advocacy that I do in the schools and in the systems is for mental health.
Mhm.
So, and it is said that our state does not serve mental health, right? So how can I be a better advocate for children living with mental health disabilities and adolescents? Because I struggle with that a lot.
Yeah, it's a lot here. I would say that you should also be an advocate for those parents and reach out for other sources that are elsewhere. Because we know that Texas is not the end of all ends, right? And sometimes we have to have that conversation with parents. Like, if you want to get the services and what the help that you need for your child, it may have to happen with relocation. It may have to happen with going outside of Texas to receive these resources. Sometimes you have to uproot your life in order to get what you need. I'm a big, testament to that. I uprooted my life. I've lived in Texas. I lived in Maryland for 30 years. And I literally just 1 week before I actually came here with no address. I didn't have an address yet, but I had already packed my house up and I already told my mom was coming, and I told my grandparents I was coming down here. I didn't know what I was going to do, but I had to get out of there because I know I had to go and reach what I needed for my child. So sometimes it takes having that conversation where you might need a little change. You might have to change your atmosphere, change your zip code. And that's what happened for me. Changing my zip code really opened up a whirlwind of things for my child. And I can't be happier that I made that decision. Scary as I was, as a single parent with my child, and I was also carrying my other child. I'm like, I got to get away to get somewhere else that's going to provide me with the care and the support and the services that I need for my child. So that's what I did. So I would just say, had that conversation, those hard conversations, but use testimonies of people that you've spoken to, like myself, and say, I know someone who uprooted their lives with nothing but an address before they left, just so they can have more support and, services for their child. So. Oh, yes, ma'am.
Hi, I commend you as a parent for being a good advocate for your child. But on the other side of the coin, how do you think we can destigmatize this? Because just as you are being an advocate, there are many parents that are not being an advocate because they see this in their child, not only in their child, they see it as a weakness within themselves. So how do you, maybe, who knows, how can you destigmatize that so all the parents are trying to get help for their kids?
I feel like it needs to be put as more of a praise that my child is here and my child is thriving and where they are, versus trying to compare them and get them to be where other kids are. And I think for the parents, for supporting them, commend them for the job well done they have done thus far, and say the job is not done. We continue this together. Parents need support more than anything, right? Because when they're trying to support their child, it's like they're forgotten because they're running to all these appointments. They're trying to make these phone calls. They're trying to get these resources, but no one's asking and checking in on them and seeing how they're feeling. How's your mental today? Have you eaten? What can I do to support you? How can I help you? As a parent, that is like the single most, if you come to me and say, Kiara, how are you mentally? Have you eaten? Have you had a moment to yourself? What can I do to support you to have a break or to have a moment where you can just digress from what you're going through? The support that others give to parents is astronomical in how that can destigmatize life, because when we don't feel supported, that's when we feel like we're defeated as a parent. We're not doing our job. So I would just say, praise them, praise mental health, make mental health a big awareness, because it's something that we need to, instead of point fingers at, uplift, because these kids need help. So that would be my recommendation.
So,
Hi.
so I have a daughter, she's 19, just graduated last year, and she's an adult now with autism. She was originally diagnosed with Asperger, and then, over the last several years, they've kind of put them under one umbrella together. But the difficulty that I'm facing now is that I live in the outskirts of Travis County. And so I found that now that I'm in Bastrop County, which is just right there, I've just cannot find any resources anymore where I'm at. And so I want to know, how do we advocate to get those things right outside of where, there's so many things I literally have talked to Integral Care and, I'm not in that, my address falls right outside.
yeah.
Right. And so a lot of the helpful tools and things that you can get right here in Travis County, I'm now outside of that. So how do we push to get those things, in these outlying communities? Because I personally have been on the waiting list
Mhm.
for Bluebonnet Trails for
Yeah.
9 months now,
Yeah.
trying to get my daughter help. And so, how do we push for these things to move out into other surrounding areas?
Have you had the conversations in the schools? Have you become like a part of the PTA or just not your child's not in school anymore, but I think we have to go to our local officials, write the letters demanding the services, demanding the help, because it is a situation that goes beyond Travis County. It's a situation that goes all throughout Texas, and we can't just be limited to having services in just one particular area. So reach out to your officials that are in your area you can say, listen, I got an issue that I need to have addressed. And I'm not going to stop until someone pays attention to it. Get people to write letters and sign a petition so that you can say, we want our voices heard about services that we need here in this area. That would be my biggest go-to. Like if I were in Bastrop County and I knew that I couldn't get the services I wanted for my child, I would start writing letters. I would start having these conversations. So maybe try that approach, start a Facebook group or community that says that we want services here in this area. So that would be my biggest recommendation. And, find me on Facebook. We can do it together. I wouldn't mind.
And I would remind you, it is a legislative year. They need to hear from parents, get involved with the agencies that represent children and families with mental health. There's plenty of agencies out there that are advocating on behalf of services and supports for the children, youth, and adults within the state of Texas to get more access, more funding, and things of that nature. The other thing would be is go to parent supports, like Ms. Kiara said, go on Facebook. There's other parents in Bastrop County that may be facing that same thing, and see what they did. Okay, this is going to be our last question. I got to bring you to Mike, Miss Lula,
Yeah.
so that online can hear.
Everything was really outstanding today. I have a daughter tomorrow will be 64 years old, and she's special need. And the thing that you all could get now, we couldn't, you understand? But I, like you, I fought for every step of the way. And I've heard no, yes, and you can't, you never will. I said, oh, but I will. So I'm glad I came to the session, because I have been helped right now. Because sometimes we have it. She stay with, she's with me, and sometimes me and her have it. But we sit down and talk, and she understands. So congratulations to you all and all that I have heard today. But to the parents, you will make it. You haven't had to fight, but you will make it, because tomorrow my daughter will be 64 years old.
So. All right, so we want to thank Ms. Kiara Price for this presentation, for sharing her journey with her daughter, and we wish you